Okay guys, look at this question that they have asked. Write short essay on obsessive compulsive disorder. Okay, so what are they asking about? Obsessive compulsive disorder short essay. So this is a psychiatry topic. They have asked for 5 marks. So let's get started. Obsessive compulsive disorder. So here there is an obsession. Okay. So first of all, you should understand there's an obsession which will lead to a compulsion. Okay. So obsession is the fear. They have a fear of contamination. So what is the compulsion? That they will go on washing their hand. Okay. So this is an obsession. The fear of contamination is an obsession. It will lead to a repetitive action, that is the compulsion, like washing hand. Okay. So this is obsessive compulsive disorder. Okay. So first of all, let us see where it sits in psychiatric disorders. F40 to 48. Neurotic stress related somatoform disorders. Under that example, obsessive compulsive disorder. 40 to 48. F40 to 48. Okay guys. So this is what? ICD code, diagnosis code. Okay. So F40 to ICD-10 they call it, right? Under that, which code? F40 to 48. If you want, you can remember this. Under this, you have the neurotic stress related somatoform disorders, under which example is obsessive compulsive disorder. Okay. Now what is there here? Here there is obsession. Obsession is what? There is a distressing thought, right guys? There's a what? Distressing thought, images or impulses. These are anxiety provoking. So fear of contamination is an obsession. Distressing thought, it's an image of contamination, impulse. These are anxiety provoking. This will lead to what? Compulsion. Compulsion is what? It is a recurrent, ritualistic, unwanted, time consuming, anxiety relieving action. Okay. So you got it right. So there is not, there can be obsession and no compulsion visible also. That is also possible. But what we are talking about, obsessive compulsive disorder, there's an obsession which is a distressing thought, anxiety provoking, which will lead to a compulsion, which is a recurrent, ritualistic, unwanted, time consuming, anxiety relieving action. Okay. And all this is recognized as one's own. That means I or the patient owns these thoughts. It's not like I am telling them to wash their hand, or I am telling them that you'll get contaminated, you'll get contaminated. There's no hallucination here. It's not an external thought. These are one's own thoughts. Okay. Distressing. Okay. So you should differentiate it from people who are normal. It doesn't affect them. But these are distressing thoughts, anxiety kind of thing. Okay. And what else should I say? OCD is common in both men and women. Okay. Other anxiety they are saying more in women, but OCD they are saying it's common in men, equally in men and women. So what is compulsion? It is a recurrent, ritualistic, unwanted, time consuming, anxiety relieving action. Very good. And all these thoughts are one's own, patient's own thoughts. Nobody is telling them to do it. It's not a hallucination also. Great, we are done with this slide. Let's move on to the next slide here. So a person who's obsessed has the risk of developing obsessive compulsive disorder. Yes. Clinical features. See, there are 2 examples they are giving here. Fear of contamination. The other is fear of forgetting something. Okay, so fear of contamination is the obsession. So what is the compulsion? Washing the hand frequently. Ritualized, repeated, unwanted, time consuming action. Okay, hand washing. Forgotten something. What is the compulsion that they can have? Going and checking. Every time going and checking. Okay. Again fearing that you have forgotten. Again going and checking. So it is unwanted, time consuming, etc. So this you have to differentiate from normal checking. Everybody has to normally check something, right? Once you do some work, you have to recheck that you have done it. That is standard, like I have checked in the code or not, or have I done 100 files I had to update, have I updated? See, that is normal. But when there is, if it's outside of normal, if it is distressing, all this you'll have to diagnose. Okay, so basically what they are saying is this is a diagnosis made by history. Okay, typically just by history they are talking about this. Now this OCD can overlap with tics, trichotillomania, that is hair pulling, excoriation disorder, skin picking, hoarding, body dysmorphic disorder. So these people can have other things, even depression possibly. Okay. Very good. Now let's move on to the management. So you can pharmacological treatment. They're talking about antidepressants like high dose tricyclic antidepressant like Clomipramine, right? TCA. Or they are talking about SSRIs like Fluoxetine, that is selective serotonin reuptake inhibitor, SSRI, Fluoxetine. Okay. Clomipramine, Fluoxetine. So where is clomipramine and antidepressants? So you can see these are antidepressants. Under that, here you have clomipramine, which is a tricyclic antidepressant, noradrenaline plus serotonin reuptake inhibitor. Clomipramine, they're talking about high dose of clomipramine, but remember it should not cause toxicity. And they're talking about SSRI, selective serotonin reuptake inhibitors. Example, fluoxetine, you can remember. Okay. Do you know how this SSRI works? Selective serotonin reuptake inhibitor, how it works? So here you can see that where is serotonin, guys? Serotonin is here, lot of serotonin inside the circle, and this gets released here, and serotonin is here, which gets uptaken by the next guy, right? So this is serotonin uptake. Serotonin is 5-HT. They are writing as 5-HT. Serotonin is getting released here, and then it is getting uptaken by the next guy. But some of serotonin is also getting reuptaken. So here you can see some serotonin is also getting reuptaken by the same guy who released it. So this is reuptake. Okay. This is reuptake. What you're seeing here being taken up by the next guy is uptake. Whatever you're seeing taking back is reuptake. So what are we preventing here? We are preventing reuptake, inhibiting reuptake, selective serotonin reuptake inhibitor. So there'll be more serotonin for the uptake. Okay. So these two are the main treatments of obsessive compulsive disorder. What will you write? Tricyclic antidepressant like clomipramine, SSRI like fluoxetine, selective serotonin reuptake inhibitor. Okay. Apart from this, what will you give? Exposure response prevention. That is a cognitive behavioral therapy you will give, which is called as exposure response prevention. That is, you expose the person to the obsessive thought, but they should not respond with the compulsive action. Okay. So let us say they lock the door. Then they'll be like, okay, wait, did I lock the door? Then they can possibly check once. Say, okay, yes, I have locked the door. Again, you should not go and check whether you have locked the door. So exposure is there. You're preventing the response. Okay. Compulsive, anxiety relieving, repeated, ritualistic, time consuming, unwanted actions you are preventing. Okay. But after this, what else they're saying? They're saying you should also give them social support. This is another treatment that you will write, social support. And then they are saying that even after all this, relapses are common and this condition can become chronic. Okay, guys. Okay, guys. So look at this now. This is the last slide that we have. This is the treatment resistant case of OCD. How will you treat? Okay. So with the SSRI, in adjunct to the SSRI, you can add antipsychotics. You can add topiramate, lamotrigine, which are anti-epileptics in classification, memantine, which is a cognition enhancer in classification, riluzole, which is going to treat some neurons, and acetylcysteine you can add, ondansetron, which is interestingly an antiemetic in classification, anti-inflammatory medication like they're talking about minocycline, which is actually a tetracycline, and celecoxib, which is an NSAID they are talking about, which can help. Okay, so very strange things. What and all are they saying, guys? Antipsychotics they are saying. Then they're talking about topiramate for the what are they talking about? For the treatment resistant cases along with the SSRI. What and all can you add? They are saying psychotic, topiramate, lamotrigine, which come under anti-epileptics. Then they're talking about cognition enhancers like memantine, then riluzole. Then they're talking about ondansetron, and then they're talking about minocycline. They're talking about celecoxib. What else am I missing here? N-acetylcysteine also they're talking about. Okay, so you can add all these. Okay, in adjunct to the SSRI. Then they are telling that there is one FDA approved therapy for treatment resistant OCD. That's transcranial magnetic stimulation. Transcranial magnetic stimulation. Okay, what did they say? For treatment resistant cases, you can try the FDA approved transcranial magnetic stimulation. Wow. So will you get the 5 marks for OCD, obsessive compulsive disorder? Okay. Thank you. Bye-bye.